Hi, it's Dr. Kreshe. Welcome. In this page, we're looking at learning disabilities and brain function. Learning disabilities are brain-based differences that affect how children and teens understand, process, and express information. By the way, these go into adulthood, so it's not uncommon that we see adults with learning disabilities. They can impact reading, such as dyslexia, writing, such as dysgraphia, math, calculation, that's called dyscalculia, and other academic skills. Um, and this is not related to the student's intelligence, which could be normal or above average. It's not laziness, it's not low motivation. Um, it really reflects the brain's unique wiring. In students with learning disabilities, brain images show that the regions involved in language memory and attention work differently rather than less effectively. For example, the left temporo-parietal region, which helps decode words, or the frontal lobe, which organizes thoughts and writing, may process information less effectively or more slowly. With practice and repetition and supportive instructions, these pathways can be strengthened, and this is a concept known as neuroplasticity, neurons that wired together, so practice and help can really make a difference. But learning disabilities aren't just about academics. They often affect self-esteem and emotional health. Many students internalize frustration or anxiety because of the repeated struggle, which can influence motivation and confidence. So early identification, structured literacy instruction, emotional support, and family collaboration help children to recognize their strengths, to build resilience, and to develop lifelong strategies. By the way, this isn't limited to children. Adults with learning disabilities who are identified can have accommodations and even treatment to help strengthen new pathways, because it is never too late to address learning disabilities and to undo the mental health stress that comes from the feelings of being inadequate or doing poorly. When we see learning disabilities as a diverse way of thinking, not just deficits, we can create environments where children thrive. In this page, you'll see the brain regions and what changes and why. We can see the core strength systems, including the HPA axis and how ongoing academic stress can cause problems, and then the map of the brain and the different messengers involved, as well as genetics and environment. Learning disabilities are heritable and strongly shaped by the environment. Experiences in early exposure, stress, or enrichment can modify expression of genes through DNA methylation. So positive environments increase brain plasticity. We want to use a biopsychosocial assessment to look at factors that can be modified and use universal design, like you have in this class, individualized instruction, and assisted technology. There is always hope with intervention. See you in class.